Welcome to the Timeless Vitality Podcast, where co-hosts Kate Beck and Amber Stitt explore the unique journeys, inspiring stories, and timeless wisdom of those who embody vitality and resilience.
Together, we discover what it means to thrive well beyond 100, sharing insights that empower you to live with purpose and create a lasting legacy.
Let's get started with today's episode.
Hello and welcome to the Timeless Vitality Podcast. I am your host for today's episode with my co-host, Kate Beck.
Hi, welcome to Timeless Vitality.
And we also are joined today by my friend, Carly, the founder of NHLMA out of Scottsdale, but with clients globally. Welcome, Carly, to the show.
Thank you for having me. I'm excited to be here.
Carly, for the audience, if they haven't met you yet on a previous podcast episode, I know you have quite a few out there and other videos on YouTube and through your websites. Can you share a little bit about what you do, the day in the life, and really what you do in your practice with national hair loss, the medical aesthetics component of that, and your consulting and teaching? Can you share a little bit?
Yeah, absolutely. I have been an image professional for over 20 years. I was a vice president of a dermatology group that focused on hair loss, and that's really where I got into it. We did a lot of transplants for men, and I found that it was very linear. It was just really male dominated, and there wasn't a lot for women. Our average age was 55 and older. And so what I started to notice was we were having some more women coming in, cancer patients. There wasn't a lot of options. And so I started doing clinicals, and I started an offshoot just to help cancer patients. And that's where I really thought I had a woman in front of me I'll never forget. And this is why I started my company. The entire time she was with me, she had her head in her lap. She could not make eye contact with me because she was so insecure after she lost her hair from chemo, and she just couldn't get it back. And I thought, I cannot have another woman ever sit in front of me and feel this insecure. And I think for us, we look at our hair, we all have different hair types, and it's what we choose, whether we have short hair, if we want to shave our head or we want long, whatever it is, but it's our choice. When that choice gets taken away and you really don't have the answers why, it's so scary. And so I went over and I did a lot of clinicals for a place here that's called Virginia Piper, and it's Honor Health, which is all over Arizona. Yeah. And within 6 months, they'd invited me to have an office within their hospital to help their clients because we had such great results. And then slowly I just started into what you see now, which is national hair loss medical aesthetics, because I really want to encompass one facility that you walked in and there wasn't just one way to help you. We wanted every aspect. So when a client came in, it wasn't that you're just a candidate for transplants or just because you had cancer. What is it that was bothering you? And then from there, we went into what is the root cause. We find a lot of times in Western medicine, people want an answer real quick. They want to have a drug that will fix it all. And I want results yesterday. Yeah. And that's not the realistic aspect of this. You know, it takes time.
And you mentioned 55 plus males and then some females. At this point in time, tell us the age range that you're treating now.
Yeah. So the age range now is 12 to 40 is our average age. So we're seeing so much now that we have never seen before. And we're seeing more kids. And that's what I speak on nationally is what is happening? Why are we seeing this? Because when we were in our mother's womb, it already knew what day and age we were going to lose our hair. The biggest thing is that we have the Nutrafols of the world and Viviscal or these vitamins, the one size fits all or Rogaine, but people don't really know what each of these things do. It's not that they're bad, but if you have a disease, then you need to be using something to combat that disease, not just an overall good vitamin. And so that's what we're really trying to teach people. I mean, just in the United States alone, we have over 1 billion pounds of pesticide a year being spread. Imagine like all of these things, 100% of us in our blood have plastic in our blood. So all of these factors affect our immune system. They increase inflammation, which increases that disease you were going to have later on in your life. It's just happening much earlier.
You're fast tracking it.
You're fast tracking it. And it's the same with our skin. And that's why we got into the medical aesthetics, because the more that we can get that inflammation out of your body, the better your skin's going to do, the better your hair, because our body, if you think about why does a cancer patient lose their hair or his hair? Because we're robbing Peter to pay Paul. They see something going on. They see that chemo and your hair is like a turtle and it goes into hibernation. It's hiding. until it knows that that aggressor's gone. And it's taking that energy to fight what else is going on. It's the same thing with every kind of disease that we have. That's the first line of defense your body goes after is your skin, your hair, and your nails. And that's why we know when people are sick because they look pale, they look weak, all of that.
On the podcast, we have pearls of wisdom. And it was really important for me to have you on the show because part of this is having purpose and empowerment. And you talk about this woman sitting in this chair and you were called to bring purpose to people, have them feel good. So as we look at all the episodes within our podcast, we want to give people the confidence to then create whatever it is for them to be timeless, to feel good and have that confidence over time. Was there a turning point that you personally had to treat yourself? Was there a moment in time that you had to kind of look at what you've been teaching and apply it to your own life?
Well, I would say probably 15 years ago when I was running the derm practice, I woke up and I had tons of hair on the ground. And I thought, that's weird. I mean, here I do this for a living. I can't be a patient too. But I was getting sicker and sicker and I couldn't find out. And I was diagnosed with Hashimoto's and also polycystic ovary disease. And one of those things I get weekly here where people think that's why they're losing their hair. And again, that jump starts that you'll have some shedding, but it shouldn't be long term. But those were big drivers. I lost almost all of my hair in the back.
I know that.
I mean, I used to get my hair thinned out. I had such thick hair. So it was traumatic. And so now I'm on something for the rest of my life because that is something that, I have in my family history. But for a woman, I can speak to that and I can speak how scary that was. But I also knew exactly what to do to help to fix that. And I think that is key because by the first time that you see a problem, and we've talked about this with some family, the first time you notice that there's an issue, just you can see through or you have a little spot, 50% has already changed.
Yeah.
It's like a wrinkle. We don't go get Botox because we just got a wrinkle yesterday. It's been happening.
Yeah.
So that's why we're trying to look at if we could stop the problem and then we have all these tools to help get it back. But if you don't stop it, let's not put a Band-Aid on it. Let's get to the root cause, stabilize it. And then we talk about stem cells and all of the other things. Like this weekend I'm speaking next weekend at the Aesthetic. This is the largest aesthetic conference in Las Vegas. It's the largest in the country. I mean, you've got plastics there. It's derms, everyone. And it's all talking about the latest in hair restoration, peptides, everything. But again, we're going to be looking at what is that fast track to get whatever it is. Lose weight quick. Get your hair back quick. It's all about quickness. But the reality is it took years and years to get that. It takes a while to get that back.
Touching back on the 50%, only because I've seen you present numerous times and I'm a patient and so is my husband of your practice. When I have my stepdaughters, they're talking about her boyfriend and he's like, oh, gotta go get that red light hat. They don't realize at 20 something that if it's like you said, if you can see through 50% of the damage has been done. Oh no, like it's now time to start. It doesn't matter what age. Let's get the treatment plan going.
Yeah. In fact, the average for men is 18. And for 18 to 29 years old is when people are having the majority of their hair loss for men. So if they knew that there was a simple prescription that would completely stop their hair loss, they could figure out how to restore it everything 15 years from now. But just stopping it, because how many of us look back even from aging aspect and go, what the heck happened? I would love to look like I did 5 years ago. Now they look better than ever. So they don't want to look like they did 5 years ago.
Right.
Because there's such new technology to make you look good, make you look natural. And I think that's the biggest thing. I think even Jennifer Aniston, she got really upset because somebody said, well, you look so good for your age. Well, why do we have a certain look for an age? It's how do you age gracefully for her age? She doesn't want to look like she did when she was 20 or 25. And I think that's what we have to kind of change our thinking of. It's not about looking 20. None of us want to look 20, but we want to look the best we can as we age.
Kate and I had this we've been reading similar books and we do that in business. And then Outlive was one that we picked up. It's a pretty hefty book. And Kate, like the chapters are saying, decades before your A1C is high. Like you didn't just get prediabetes, last week because our family had it. It's potentially could be that. We're not doctors, but in the reading, we're finding that it takes a long time to sometimes get to the point where we see these chronic problems.
It feels important to be preventive and ask the right questions before there's an issue. Carly, do you have any recommendations for what questions should we ask, or when would it be the right time to know that we're in that area?
For hair loss or for skin, are you thinking?
Let's do both.
For both. Okay. Like earlier, you're like, oh, when you notice that spot? And immediately I'm like, oh, like, you mean like this little thinning spot on my bangs that once was like, at what point is it time to really, like, what question do you ask, or how do you know if you're being overly anticipatory or if it's perfect timing?
Yeah. I think always seeing a specialist at the beginning is always going to be key, because you should really just go learn. And that's what I tell clients when they come here. We don't want you to do a thing. We only want you to come in. Let's take a look. We look under a microscope, or we can do a follicular analysis, whatever it is. And then we'll give you a game plan, and then you take that away. So at least you know how to take care of your hair, how to be washing, how to be doing all of these little tips and tricks, because a lot of that is the wrong information. For instance, I know, Amber, when I told you about washing, the first recommendations people get when they're having hair loss is wash their hair less. That's the opposite. So you have a hormone that's coming up through your oil glands every day, and you want to remove that. And so you have an inflammatory disease, which means that you have redness. It can be hot. It can be itchy. So you do need to use proper hair care to address those. The other thing is that for women, if you're a woman sitting watching this podcast, what if I'm worried about if I'm having hair loss? I'll tell you 2 ways to know for sure if it's a genetic type. One is the pattern. If I have a thyroid disease and I have a guy coming in and he's bald, he doesn't go, look what my thyroid did. Never. He will say, I know I have genetics, right? But a woman never comes in saying that because she's not bald. So women have the bulk of their hair loss where their part line is just thinning. And then it starts 1 finger length back right here. And then the temples start to get kind of see-through. That's how we know, number one, that we have some hair loss starting. The other thing is if you feel back here, your occipital bone, that little bump in the back, feel your hair and the texture. It's nice and coarse, whatever your texture is, you've had your whole life back here. Then feel it in areas that you're concerned. If that texture is finer, then you know that you're having a type of more permanent hair loss, because permanent hair loss is where that hair gets finer and finer and it dries up, not the falling out. So that's a big misconception. Now, if I just got diagnosed with, or I get on semaglutide, let's talk about that. I'm getting on tirzepatide. You 4 to 6 weeks later are going to have a massive shed. That's not hair loss. You could lose 30,000 hairs and not see through. The seeing through is actually the hairs getting finer. And that's a totally different type of hair loss. So just looking at your pattern and what you're losing it, because if you have thyroid, anything, polycystic, whatever, you won't have thick hair back here and only thin hair up here. So I always say, as soon as you start to see an issue, see a professional so that you can actually find out, because once that hair is gone, it's gone. It's dried up. So there is this window that you can. So we can't resurrect the dead if the hair comes back. It's because it was sick. But there's a lot of times there's hairs under the microscope that look like it's totally gone and it's there. So we want to give you realistic expectations, not promising anything, but also wanting to stop it. Same thing with your skin. After you finally start to see some deep wrinkles, you're starting to see sagginess. This has already happened. Your collagen is dropped. And that's where we want to see how we can help slowly start building that up.
Carly, some of your, do I want to call it testing? I know that your practice works with epigenetics. I've done that myself with you. And that is one of the resources that can look 90 days back and tell a story. And you're basically saying that start in advance, learn before you build that action plan. Like, let's just get the information, because there is no quick fix. We got to go internally to see what's going on. Part of that testing you offer, we haven't talked about that yet, but we'll link an episode that has that information. But part of what you bring to the table for these clients, these patients, is more of like an internal viewpoint of the science of their specific body. So like Kate, we talked about, let's take some vitamins for hair and nails. You have amazing skin, but sometimes there's a treatment plan, like you talked about Carly Rogaine and these different things that are more specific for the individual. It doesn't work for the masses. So It's a very loaded statement I just said to you, but part of your process is to see the person under the microscope. Then we can do some further testing plus blood. Let's kind of keep going with that. What's the approach to really look under the hood?
Yeah. If I drew all of our blood today, how many of us would have the exact nutritional deficiencies?
Yeah.
Perfectly. None of us. We might not have even one thing in common in our blood work. So when we look at these marketing campaigns, that's a one size fits all. Those are a list of good items that are good for everybody. But what happens is when we have to take our other prescriptions or our other vitamins that we know that our doctors told us that we're low in, now we're not absorbing those as well because we're clogging it with something else. So that's why we say each of us are individuals. How many times have we gotten our blood work and it says we are within range in everything and we do not feel well? It's because it's taking a national average, but we are individuals. So what we do is when we take this testing, it will tell us exactly what you're having a hard time with, what nutritional deficiencies you have, so that if it's in all these different sections, then maybe that's the one thing you supplement. But we're more interested in getting whole foods where you're deficient in organically versus here's a supplement. Mm-hmm. And I think that's the difference is we're trying to do kind of a lifestyle change where we're not trying to get you on a bunch of medication. We're not trying to get you on some prescriptions, which is where a lot of Western medicine goes. That's the first thing. It's just like with alopecia. Your derm will either do minoxidil, oral minoxidil now because it's a pill, or will just shoot your scalp with some steroids. That's never going to be what's going to stop the hair loss. Mm-hmm. So that's one way that we check to see how you're doing. But it's just like if you had a liver disease and you have a transplant, you have to take an anti-rejection for the rest of your life. It's the same thing when you have genetic hair loss. You have to take an anti-rejection, which is not a supplement.
Ah, interesting.
Can you heal? Do you have history of healing people with alopecia, or is that something you just live with?
Absolutely. No, it's a disease that your body wants to go after, and there's ways to stop it. And there has been ways for 15, 20 years. It's just that when you go to a hair loss facility, if they know the latest on all of that. So there's been a drug out for 20 years that stops male pattern baldness. And everything that we do, I never put out to clients unless we've done a full clinical. And so any of our stem cells, we have a 1 to 2 year clinical that we do before that is allowed to even be a treatment at our office. I also did the FDA clinical for laser therapy, prescription grade lasers. It's the first time we can ever tell a woman we can totally stop the hair loss. Yeah. Rogaine's never been FDA approved to stop it. It only slows down hair loss by 10%. And most people take it because what do they think is going to happen? It's going to stop my hair loss and I'm going to regrow it. So then they stop it because they didn't have the right expectations, and the little bit of help it was doing, then it all falls out. It's the same with when I go speak on PRP or stem cells. People get some good results at the beginning, but they never fixed the cause. So then the body just starts to attack all the hair that just grew. So it's just training the providers correctly so that they know how to stabilize, so that when they do these stem cells, they're going to see a lot better performance.
And let's keep going with that because Carly, I know we've talked about this in the past and you travel all over. Is there, just like human behavior, where some providers might get in this pattern of just same things, same products, and not innovating?
It's probably 70% of providers out there. Providers, especially if you're insurance-based, they have 5 to 6 minutes to see you. It is hard. So they're not getting what is your lifestyle. Yeah. They're not getting more of what is your routine. So then it's how do I get them something as quick as they can to help them feel better. And so when we look at how we can help providers, the whole goal is if you're going to bring on a service, then at least track it so that you know that it's working, or how do you pivot? And I think that's the biggest takeaway when I do these educational seminars, or if we do our classes, is we're teaching them what is the disease. These are the ways to boost it, but it's not the one modality, because hair loss is now the number one Googled, looked up cosmetic procedure right now since COVID, more than breast, nose, anything.
Is it possible that it's number one because a lot of people are taking insulin-assisted weight loss drugs right now?
No, it happened during COVID because when people got sick and they're doing the vaccines, any new introduction to these items, it's not vaccines, whatever you think about that, doesn't matter.
Yeah.
It's just a foreign agent. Your body, again, is robbing Peter to pay Paul. So this is when we saw hair loss numbers skyrocket. What was everybody on? They're on a platform just like this, looking at their hair. And so now all of a sudden it's like, ooh, or my skin or whatever. It's like, it's a magnification. So this is when it started. So the business, it's huge. So what do people do? Well, now doctors have to learn about hair loss. They never were, it was never going to be in their wheelhouse. Everybody's doing something and they hear exosomes work or stem cell. I'm going to do PRP and they just glob onto that and do a couple things. They've never really been trained. They trained how to spin down the blood, but not really where to inject, how to follow up, how often you should be doing it. So that's where the key is. And then you've got people who are like, well, it didn't work. What did you do to stop it? So we're seeing more and more people jump on the bandwagon, just not with the proper education behind it.
So let's talk about human behavior in general. And this is really why it's important for Kate and I to have this platform for people is to feel good, to have confidence, but they do have to do the work. And what I'm hearing is like this underlying common denominator that whether it's a provider or a patient, get some information, not just by Google, but talk to specialists. I've heard you say that a few times, but it's got to come from within. We got to work on the internal components, the nutrition, that wellness, and it could be a number of things, but you got to do the work to have this resilience factor.
Yeah.
And not just do it temporarily.
No, I won't even allow somebody to start on a program if I feel like they're going to be willy-nilly, because at the end of the day, it's going to just be more work for us. We see clients every 12 weeks and we take microscopics and digitals if they're doing hair loss. We have to make sure that we're being consistent on our end. And if we have somebody who they've jumped around from place to place, they all come with a preconceived notion on why they think they're having hair loss. So they've gone down that WebMD rabbit hole. They've self-diagnosed. And I say, you know what? When you're ready and you're ready to take that jump, maybe we need to do this later because we know how to deal with this, but you have to be ready because it is a commitment. You will have hair loss till the day you die unless you get involved with this. And if you wait 5-10 years, now we're going to just be talking about toppers and how to conceal it because you've lost that. And they'll say, well, my mom doesn't have hair loss like me. That's because your mom didn't grow up in an environment like us. It's a totally different game with food and all these different environmental challenges that we've never had before. And so it's not a bad thing. We're growing in one aspect, but our body is more depleted in a lot of ways, and we have to learn how to reinvest into that.
I wanted to ask a question when you were talking about during COVID. Am I understanding that it's because of the EMF or all of the doing Zoom and all of this is the reason for hair loss?
Oh, no, there's always been hair loss, but where we saw a huge uptick in hair loss is when obviously stress can cause major hair loss. And during the pandemic, everybody had stress. I know dentists had a huge bump in their business because everybody was grinding their teeth. So they couldn't keep fillings. And also people were on a lot of anxiety and depression medications. So that played a role. And then all of the shots. So if somebody hadn't had a vaccine in many years, that always is a shock to the body. And so if they were going to have hair loss in the future, they had all these other changes that just made people lose. I had people losing 40-50% of their hair. I mean, clearly has lost a lot. So all of the other EMFs, nutritional deficiencies, pesticides, anything like that is what we're seeing more and more and more. And that's why the age range is going lower than ever before because of those things. But right now, when we look at the business as far as why so many people are reaching out about hair loss is because really since COVID, this has just jump-started everything. I mean, more than what it was before, because it's always been a big deal, but not to this extent.
The social media posts, reels, tons of podcasts started. Yeah. And then Zoom, you're on Zoom for work. So everyone's like, oh, I got to look better on camera.
How does somebody out of state arrange for a consultation? Do you do that by Zoom? Or if they wanted to take these, like, can you get a test started? Like, say you're in Oregon and your spouse has alopecia or things with their scalp that they can't figure out. And they've been to all the specialists. They've been to all the doctors and they're all like, here's some more antibiotics. I don't want to take antibiotics. Like, how does someone out of state get started?
Yeah. That's a great question. We have almost 35% of our patients live out of the state or out of the country. And so it's always going to be about a virtual consultation so we can see the type of hair loss. We also work with a lot of organizations that do certain kind of clinicals for people who have more extensive hair loss. Maybe they've lost all of the hair on the head and the face, the body. There's certain ones that we'll be able to get them involved with. Right now, we're working with a 28-year-old out of Washington State that he's lost his hair when he was like 9. So we're getting him involved with some of the more extensive ones. These labs, we work and draw blood all throughout the country. We do the hair follicular testing. Those are a kit. We can do everything we can do in our office virtually. So that's the great thing. So it's just really about getting a consult so that we know the type of hair loss that you're experiencing so we can give you the right recommendations.
Thank you.
Yeah.
And we'll point some information, obviously, in the description box for you, Carly. There's some resources there too. But outside of vanity, really vanity in the sense that we want to look good on camera, whatever these pieces, these feelings are for us. Bottom line is if hair loss is a result, it's happening younger and younger. It comes back to that wellness factor. There's genetics, like you've said, since we're in the womb, we have this potential hair loss that's going to happen. You said it's in our DNA. But ultimately, if we're not healthy, the results could be whether it's stress or maybe that surgery, that shot, something has caused this shedding. But this is a clear indicator. Often it sounds like that something else is going on and you're just not going to feel well. And I bring this up because when it comes to me asking you, and after over 20 years and even your personal experiences, what is it really for you? Like you see these patients, for someone to feel or to be timeless, what must they do just to help themselves have this long life to be healthy and well?
Just finding the right providers next to you and finding somebody who has heart. And even for me, I have in my wheelhouse as much as I can. I have the best of the best that I can send out and work closely. And those people I know have heart too. So I think that's really key, is getting somebody in your corner and just making that first step to get things figured out. Like you were talking about your A1C. I cannot tell you how many people this is out of control with. And, you know, your sugars, everything. That is your whole system. You're going to feel horrible if that's off. But working with a group of providers that have your back and that you just have to make that call. And I think so many of us put off our health, and we need to make that a priority, because there are ways, if you can start off and initiate when there's small problems versus waiting till there's really large problems to deal with. And that's with anything. Don't wait.
It sounds like it is okay to go get a second opinion if you go get some advice and it's just not fitting the feelings you have. Go get a second and a third.
Yeah. Always. I always say interview. You know, when it even comes to labs, I wanted to bring this out. When you do blood work, especially for hair, there are certain labs that you have to get done when it comes to hair. The top ones are iron, ferritin, your vitamin B12, and your vitamin D. And so sometimes, most of the time, people are within ranges on those. But you actually need to be a little bit higher in those. So I have clients who are literally have great iron and their ferritin is rock bottom, and their doctors always said they're within range. But for hair loss, they're not. And this is why they've lost like half the hair. Vitamin D is crucial. That's what changes our growth cycles and shortens them. So if your vitamin D is low or you're within that range, but for hair, you need to be higher, we're never going to see those results that we need. And so that's why you have to do a combination. That is something that I would love to get out there to people, is check your labs when it comes to those and know what your numbers are. What is your hormone levels? Get those checked.
Sounds like if you're in more of a rainy, cloudier state, you might need more vitamin D.
Yes, you might need to get one of those little lamps.
All right. So Carly, I really appreciate you being here. I feel that if we're going to approach, whether or not you want to be a centurion, but just living these long, happy lives, we got to take some initiative and do some research. But we love that we can bring our listeners to you. And I know that people are able to do consultations, even remote, like Kate, you asked that question. So is there anything else you'd like to share before we wrap up, Carly?
I'm just glad that you're bringing this awareness out. I think for all of us, especially when whatever profession you're in, you want to look your best and you want to feel confident. And it breaks my heart when I see such young ones, especially teenagers, before they've really started their life and having them struggle with something. And if we can help our young ones and our young adults with their confidence, what a better start that they can have. It's not all about looking like, the Kardashians, but we don't want them to have, missing hair or something like that. And there's nothing better than when you see somebody walk in that has their confidence back and they see the difference. To me, there's not a better job in the world. It's just amazing to be able to give that peace back in their life.
Well, I know you and your team care. Even when it comes to our furry little pets, you guys care about the whole family.
Yes.
And so thank you so much for being here, and can't wait for people to learn more about your practice.
Yes. Thank you for having me. It was nice to meet you, Kate. And thanks, Amber, for letting me share.
Thank you for joining us on the Timeless Vitality Podcast. We hope today's episode has inspired you to embrace the journey of thriving well beyond 100.
Remember, your story is still unfolding, and every step you take adds to the timeless legacy you are creating. Until next time, stay vibrant, stay empowered, and continue living with purpose.
We'll see you on the next episode.